We are pleased to host Mr. Rowland, who is Director and Chief Medical Officer at International Public Sector Health at Amazon Web Services. Welcome.
Thank you very much for inviting me.
So, just moving on to the first question. We at FPA, we seized the opportunity to get your opinion as both a professional inside with the perspective of the manager and the one perspective of the doctor. And we realized during this past year that world has changed and is continuously changing due to the pandemic. And also institutions are becoming more aware that to tackle the complexity of our time, there's the need for a more collaborative, more transdisciplinary approach, which is the One Health approach. That is the guide principle of this Forum PA Health 2021. What I would like to ask you is, what do you think about this One Health approach, and how can technology concretely help the implementation of this strategy?
Perfect. Once again, thank you very much for inviting me to comment. It's a fascinating topic and very relevant, not only to Italy, but for the whole of Europe and indeed the world. I like the CDC definition of One Health, which is a collaborative, multi-sectorial and transdisciplinary approach, working at local, regional, national, and global levels, with the goal of achieving optimal health outcomes, recognizing the interconnection between people, animals, plants, and their shared environment. And I think this approach focuses on social determinants of health as well. So not just the clinical, but also the incorporation of population health and all that goes with it. I think we see technology making a tremendous impact in this area, and it will continue to do so going forward. I think the amount of data which is being gathered at state, local, and national levels is increasing exponentially. And we're seeing that countries are making decisions really to go to cloud in the first instance. They have fully go to cloud strategies in place already, because they recognize that cloud is a secure place to store healthcare data. And it's really the only place where countries are able to manage the quantities of data which are being generated, and also to define outcomes from it. So the analytics component is really important. Some good examples of this are in the UK, in fact. So we're working very closely with Genomics England. And during the pandemic, Genomics England launched an initiative with the UK government to deliver a cohort of patients who'd had their genomes sequenced. So they had 20,000 genomes sequenced from patients who'd had severe COVID, and a further 15,000 patients who'd had less severe COVID. And they were able to add this to the data from the 100,000 genomes already stored, and share this with 8 leading pharmaceutical companies and research organizations to fuel and accelerate vaccine delivery, treatment, and early detection research. And the cohort partner, LifeBit, was able to build this environment in the cloud, going live in 3 months. And it's very important to understand that these data don't need to be sent anywhere or downloaded. They can be stored securely in the cloud and made available to specific researchers who've been given permissions. Similarly, in the UK Biobank has just unveiled its research analysis platform, and that's to allow access to 500,000 people's data, which is 11 petabytes of data, growing to 40 petabytes of data by 2025. And just to put that in context, if you were going to continuously view 4K video on a screen, it would take you over a century to do that. That's the scale of the data we're talking about. This research analysis platform built with DNA Nexus is incredible, because again, it stops researchers having to download this vast amount of data on their own premises. They can do it all in the cloud, and also have all of these computing tools, the AI and machine learning next to the data, so it can really democratize the access of these tools and the data to all kinds of researchers all around the world. And I think that as we're getting more and more sources of data, so going back to that One Health, where we find more data streams, not just about clinical data, but also about behavioral data, about social data, environmental data, all of these data streams coming together will take an enormous amount of computing power. And really, cloud is the only way to go forward. And we can surface this for startups. So more startups are building in the cloud than anywhere else. And we've got examples of this in the Netherlands, in Radboud, where they built up a grand challenge platform to surface data for researchers around the world, where 40,000 researchers can log in into a secure environment and build new technologies to help patients. I think that, that working towards making technology disappear is really important. So where researchers and end users, clinicians, caregivers can access this kind of power of computing at the point of need. So where they're seeing the patients or consumers or citizens, really making that data available at the point of access is going to be really important. So just a few examples of what we're seeing around the world.
Thank you. These are very, very interesting insights that make me think also about another issue that have been raised during this period, that is about data governance. Data governance of health data, you know better than me, is crucial for the determination of predictive models, predictive policies, and also for health expenditure. So it is finally the time for countries to discuss the possibility to have national data strategies. And what do you think these national strategies should be? How they should be designed? How should be implemented?
Again, very interesting topic, and we're seeing countries asking these big questions across the board. So we have been working very closely with different nations to support their data strategies and how they would like to build. So we're working very closely to support and to really deeply understand the mission of countries, to find out what they would like, what they want to do with their own data. For instance, we've been working very closely with the Indian government around their national data strategy, and they have had a very interesting program during COVID, bringing telemedicine to their citizens. So we worked very closely with them around the e-Sanjivani telemedicine program, enabling citizens to seek medical care and consultation. Over 1 billion people can now access medical care through their telemedicine platform. Working very closely, the governments have announced tenders and requests for support to really understand data at scale, to integrate all of the data coming from their various platforms to make sense for their citizens. We know that citizens trust healthcare providers to manage their data. And we know that cloud enables providers to stand up trusted research environments without the need to move data here and there. And it's really important that citizens trust their healthcare providers and their states to manage their data appropriately. I think we've seen that cloud can securely store, manage, and access data. It's very important that the next level really is to understand what that data is being used for, to feed that back to patients. I think that trust is a real consideration around the use of data, and to reassure citizens that their data is being used appropriately. We already know that the cloud is being used to securely store strategic defense data, banking data. There are many, many very sensitive classifications data already being used in the cloud. And I think it is beholden to all of those involved in healthcare to reassure the public that the data is being stored and used appropriately. And we're working with governments on those big questions of how to extract meaningful data from extract meaningful information to support citizens from the data that's being gathered. I think it's a very, very important topic, and it will only continue to get more important as time goes on, as more data becomes available and we start breaking down the silos. Data liquidity is a very important concept. So how do we free up data from the individual silos in which it resides to bring it together to really extract the most meaning from it?
In conclusion, I would like also to ask you just a comment about the possibility to do something more about data governance in terms of ownership. What do we have to ask to the legislators for the future? How do we have to protect people's privacy?
I think, I suppose in conclusion, what I'd say is that the foundations for cloud healthcare, or storing healthcare data in the cloud with respect to security, privacy, and compliance are already in place. Given the volume of storage and compute power required to gain actionable insights from this massive volume of data, I believe the use of cloud will only increase further over the coming years. As I said, the second point is that patients already trust healthcare providers to manage their data, and cloud enables these providers to stand up trusted research environments without the need to move data around or to download it anywhere else, as we saw from UK Biobank and Genomics England. It also empowers patients to have access to their own data through secure portals. And so finally, I think to take this trust to the next level, we must describe exactly what patient data is being used for, be clear who is using it, and demonstrate the clinical benefits derived from it, both the patients themselves and to society in general.
Thank you so much, Dr. Rowland Ealing, for being with us and for sharing your thoughts with us.
Great, thank you. It's a pleasure.